Assalamu alaikum, everyone. I'm Dr. Hafiza Hifza. Today, the topic of my presentation is Sylvian fissure vascular anatomy. The Sylvian fissure is the most distinct and consistent landmark on the lateral surface. It is a complex fissure that carries the middle cerebral artery and its branches and provides a surgical gateway connecting the cerebral surface to the anterior part of the basal surface and cranial base. So it arises as the larger of the two terminal branches of the internal carotid artery, and its diameter is ranges from like 2.4 to 4.6 millimeters, roughly twice that of the ACA. Now, this diagram is basically showing the branches of the MCA. Here, this is the superior trunk. This is the inferior trunk. Superior trunk is supplying the superior surface of the cerebrum, and the inferior trunk going towards the inferior surface. These are the branches of the MCA, which I'll be discussing further. Its origin is at the medial end of the Sylvian fissure, lateral to the optic chiasm, and below the anterior perforated substance and posterior to the division of the olfactory tract into the medial and lateral olfactory stria. Um, this picture is basically showing the origin of the MCA. This is the optic chiasm. This is the internal carotid artery. This one is the ACA, and this is the MCA. So this is the M1 segment of the ACA. These are the lenticulostriate arteries arising from the M1. So it basically arises medial to the Sylvian fissure and lateral to the optic chiasm, as we can see here. Here, this goes in towards the Sylvian fissure, where it becomes the M2 segment. So this is basically to show the anatomy. This is the optic chiasm, the Sylvian fissure, and this is the olfactory tract. And here is the MCA arises. So it's lateral to chiasm, medial to the Sylvian fissure, and posterior to the olfactory tract. This is the uncus of the temporal lobe. So as it passes below the anterior perforated substance, it gives rise to a series of perforating branches, the lenticular striate arteries, which I have previously shown. So these are the lenticular striate arteries. This is again the same picture showing the lenticular striate arteries arising from the M1 segment. Now, this is again showing the relation. So here, this arises from the internal carotid artery. Lateral, this is the chiasm. So lateral to the chiasm, and then it goes towards the Sylvian fissure, where it becomes the M2 segment. And here it takes the 90-degree turn as well. And this is the olfactory tract. So it lies posterior to the olfactory tract. This is the superior view here. This is the sagittal sinus. Here we can see that MCA arises and goes laterally towards the Sylvian fissure, and this is the ACA, which arises from the internal carotid and running in the interhemispheric region. And so when M1 reaches the Sylvian fissure, it becomes the M2 segment. Then it takes 180-degree turns and becomes M3, and then again another 180-degree turns and becomes the cortical branches, which is called M4. So this is the optic tract, and this is the M1 segment. So this picture basically is showing the symmetry of the MCAs arising from the internal carotid and going towards the Sylvian fissure. These are the cortical branches. Here, this is the Sylvian point where it takes the sharp turn and becomes the M4. It divides within the Sylvian fissure and turns sharply posterior superiorly at a curve. So the curve which it takes, the 90-degree curve, and becomes M2 or the Sylvian segment, is called the genu to reach the surface of the insula. At the periphery of the insula, the branches passes to the medial surface of the opercula of the frontal, temporal, and parietal lobes. Its branches pass around the opercula to reach the cortical surface and supply the most of the lateral surface and some of the basal surface of the hemisphere. So segments of the MCA, it is divided into four segments. M1 is the sphenoidal, M2 is the insular, M3 is the opercular, and M4 is the cortical. Here we can see this is the chiasm. This is the M1 segment, and this is the genu, and then it turns 90-degree and then becomes the M2 segments in the Sylvian fissure. And here it takes a 90-degree turn, sorry, 180-degree, and then it becomes the M3. And then these are the M4 branches, which are going towards the cortical surface of the hemisphere. So this is all another picture which is showing the relationships. So these are the optic tracts. This is the optic chiasm, the olfactory tract, and laterally we have the Sylvian fissure, and this is the uncus. Now, this picture is basically showing the Limen insula. So this edge is known as the Limen insula, where the M1 segment becomes the M2 segment. This is the anterior perforated substance. And here we have the carotid cistern. So when it enters the Sylvian cistern, it becomes the M2 segment of the MCA. Now, this picture is again showing the same. Here we can see this is the M1 segment. This is the Limen insula. And here it turns and becomes the M2 segments, a segment of the MCA. Then it runs on the insular surface. So hence called the M3 segment or the insular segment. And it is also related to the opercula, so also called the opercular segment. And then it goes towards the cortical surface where it becomes the M4 segment. This is again showing the origin and the segments of the MCA. Uh, this is the level of midbrain. Here we can see so these are this is the PCA. Anteriorly, we have the ICA, which is giving the MCA. This is the M1 segment. Then this is the genu. And this is the M3 segment. So M2 segment becomes the M3 segment at the circular sulcus, and then it goes towards the cortical surface where it becomes the M4 or the cortical branches. M1 begins at the origin of the MCA and extends laterally within the depth of the Sylvian fissure, as we discussed. It courses laterally, roughly parallel to 1 centimeter posterior to the sphenoid ridge in the sphenoidal compartment of the Sylvian fissure. And this segment terminates at a 90-degree turn, the genu, located at the junction of the sphenoidal and the operculo-insular compartments of the Sylvian fissure. M1 is subdivided into pre-bifurcation and post-bifurcation part. The pre-bifurcation is composed of single main trunk that extends from the origin to the bifurcation. And the post-bifurcation trunk of the M1 segment run in a nearly parallel course, diverging only minimally before reaching the genu. This bifurcation occurs proximal to the genu in nearly 90% of the hemispheres. This is again the anterior view, which is showing the division internal carotid artery, the M1 segment, lateral to the chiasm and medial to the fissure. And then M1 segment takes a 90-degree turn, which is called the genu, and it becomes it enters the Sylvian fissure, where it is called the Sylvian segment or M2 segment. And these are the lenticular striate arteries. So this is basically showing the turns which the MCA takes. So this is the MCA. M1 segment, and it divides into the superior and inferior trunks. So superior goes to the superior surface of the hemisphere and inferior towards the inferior part. And this green part is the M2. Here it takes the 90 degrees turn and goes in the Sylvian fissure. And then from there, it takes the 180-degree turn and then becomes the M3, which is the yellow part. And then again, it takes 180-degree turn and goes towards the cortical surface. So M1 M2, M3 or the opercular, and M4 or the cortical branches. This is again showing the same. So M1 segment, M2 segment at 90-degree turns, then 180-degree turns and becomes the M3, and another 180-degree turns and it becomes the M4, which is the cortical branches. So this is again showing the same picture. M2, 90-degree turn, the genu, M2, and then M3, and then the cortical branches, M4. This is the midbrain related to the PCA. Now this is the lateral view. Here we can see that these are the cortical branches on the surface, making the M4 segments, M3 segments related to the opercula, and M2 inside the insula. So this diagram is again showing the branches and the distribution. So M4 or the cortical branches, M2, and then these are the M3. This is again the lateral surface showing the superior and inferior trunks, becoming the M2 90-degree turns, which is the genu basically, and then the M3 segments, which run on the surface and then takes another turn and becomes the cortical branches of the MCA. So the similar picture, superior and inferior trunks, M2, M3 at the takes the turn and become the cortical branches at on the surface. This is again the closer view of the Sylvan fissure. So we have retracted it superiorly and inferiorly. And um, this is again the M3 segment, M2 segment, and going towards the cortical surface, becoming the M4 segment.
Dr. Hafza, have you discussed the Sylvan veins as well, or you've just are you going to just discuss the arterial
So
vasculature
I
of the
have few
insula?
slides. I have few slides
Okay.
uh, for the veins as well. So this is again superior and inferior trunk, insula, and these are the M4 branches and M3 branches. M2 segment includes the M2 segment includes the trunk that lie on and supply the insula. This segment begins at the genu where the MCA trunk passes over the lumen insula and terminates at the circular sulcus of the insula. So this is again the same picture showing the M3 and M4 segments. This is the M2 running in the insula and it becomes M3 segment at the circular sulcus. This picture is again showing lumen insula where M1 takes the 90 degrees turn and becomes the M2, and then at the circular sulcus it becomes the M3, and then these branches goes towards the cortical surface and becomes the M4 segment of the MCA. So M3 segment begins at the circular sulcus of the insula and ends at the surface of the sylvan fissure. The branches forming the M3 segment closely adhere to and course over the surface of the frontoparietal and temporal opercular to reach the superficial part of the sylvan fissure. So this is the same picture. It's showing the 180 degrees turn with the MCA takes, as we have already discussed. So this is the MCA. It becomes M2 here where it takes the turn and Sylvian becomes the Sylvian segment. And then here at the level of opercula, it becomes the M3 and then goes towards the cortical surface. The M4 is composed of the branches to the lateral convexity. They begin at the surface of the Sylvian fissure and extend over the cortical surface of the cerebral hemisphere. So these are the similar pictures I have already discussed. So now coming towards the perforating branches of the MCA that enter the anterior perforated substance and are called the lenticular striate arteries. There is an average 10 of the lenticular striate arteries per hemisphere. So the lenticular striate branches arise from the pre-bifurcation part of the M1 in every case and from the post-bifurcation part of the M1 segment in half of the hemispheres. Lateral and intermediate groups of lenticular striate arteries supply the upper part of the internal capsule, the body, and the head of the caudate. And the medial lenticular striate arteries irrigate the area medial to and below that supplied by the lateral and intermediate lenticular striate arteries. And the lateral part of the globus pallidus, the superior part of the anterior limb of the internal capsule, and the anterior superior part of the head of the caudate nucleus. Now, the cortical distribution or the cortical territory supplied by the MCA includes the majority of the lateral surface of the hemisphere. All of the insular and opercular surfaces, the lateral part of the orbital surface of the frontal lobe, the temporal pole, and the lateral part of the inferior surface of the temporal lobe. So this picture is showing the cortical distribution of the MCA. So it gives off orbitofrontal, frontal, prefrontal, precentral, central, anterior parietal, posterior parietal, angular, temporal occipital, posterior temporal middle, and then the temporal polar arteries of the cortical distribution. Then the main trunk of the MCA divides in one of three ways. It either bifurcates into superior
Not,
or inferior
not,
trunks.
not all these not all these branches were from MCA. I mean, some of them were branches from ACA as well that you just
Uh,
mentioned now. So, okay,
okay,
just continue. Continue.
So the main trunk of the MCA divides in one of three ways, either bifurcates into superior and inferior trunks, or there is trifurcation into superior, middle, and inferior trunks, or there can be multiple trunks. In 78% of the MCA is divided in a bifurcation, 12% divided in a trifurcation pattern, and then 10% divide by giving rise to multiple trunks. Here we can see so usually, mostly we have the superior trunk, which is supplying the superior part of the hemisphere, and this is the inferior trunk, and this is equal, like equal distribution. And then bifurcation, inferior trunk can be dominant sometimes, and then the superior trunk dominant in this picture. Then we can have the trifurcation in 12% of the cases, and these and this is showing the multiple branching patterns. Now, the stem arteries arise from the trunks and give rise to the individual cortical branches. So these are the main trunks from where the stem arteries arises. So this is the pattern of stem arteries. So this is the usual case in which we have orbitofrontal, prefrontal, or precentral, and then the central. So two stem arteries are supplying here. And in this part, we have three stem arteries highlighted in different colors. And then for this, we have the anterior temporal, middle temporal, posterior temporal, and temporal occipital, 24% of the cases. And these are some variations which can be there. So stem arteries are usually three for the two for this part, and three, and then the four for this region, but it can vary. Now, coming towards the sylvian veins, so the important vein is the vein of Trollard, which connects the superior sylvian vein, which runs in the sylvian fissure, to the superior sagittal sinus. And then we have the vein of Lebbe, which connects the transverse sinus with the superior sylvian vein. And it runs on the temporal side, and it runs superiorly towards the superior sagittal sinus. Here we have the superior sylvian vein, vein of Trollard and Lappe. Now, this is again showing the same. This is the transverse sinus. This is connected to the superior sylvian vein via this vein of Labe. And these are the deep sylvian veins, which runs in the sylvian fissure. This is again showing the same insular deep sylvian veins running inside, and the vein of Labe, which connects this with the superior sylvian vein. This is the superior sylvian vein running in this fissure, and these are the insular veins uh, running inside this fissure. So this is again showing the same. These are the deep sylvian veins, insular veins, vein of Labe. If coming towards the radiology here, basically it's showing the origin of the MCA. This is the A1 segment, M1 segment, which is becoming the M2 segment, and this is the genu. Um, then M2 becomes the M3 segment, and then M3 is becoming the M4 segment going towards the cortical branches. This is M3, M2, and M1. And this is the Sylvian point where it takes the 180-degree turns and goes towards the cortical surface. These are the lenticulostriate arteries which arise from the M1. And this is showing the cortical distribution of the MCA. So these are orbitofrontal branches, opercular, precentral behind the central sulcus, and then precentral, sorry, anterior to sulcus, and then central, posterior parietal angular artery, and then the posterior temporal and the middle temporal. Thank you.
So, Hifza, can you go back to one of the slides which shows all the anatomy of the MCA? I mean, you've shown
Okay,
multiple
okay, sir.
pictures. You showed multiple pictures which showed the same thing, moreover, now. So how about you
Yes,
just
sir.
go back to one of the pictures that you show best shows the anatomy of the MCA, all the segments, the turns that you talk about. Just one picture that you think shows, yeah.
So so this is showing the origin, and then
So not the origin, the whole course of the MCA, just one picture. If you cannot show it one picture, maybe just two pictures where you
uh,
can.
okay, okay, sir. I
How,
think
how about we start from this?
yeah, yes, sir, we can.
So can you orient on how on this picture is what sort of a view is this? What's the anatomy here? Is this like a coronal cut or where is the cellular picture? Can you use a pointer?
Yes, sir.
And yeah, so are you showing it from the
Sir,
top
no,
with
sir.
the
This
if
is inferior view.
you think this is an inferior view? And what makes you so can you see the brainstem?
Sir, this
Yes,
is the
that's this is the
midbrain,
midbrain,
and
right?
here we have the PCA which runs around the midbrain. So I think this is the
So
inferior view.
let's start
So we,
from where the let's start from where the MCA arises now. So the
yeah.
MCA arises from the
So,
bifurcation of the internal carotid. Now the M1 segment is from the origin till the bifurcation.
yes, sir.
And what is this
So
segment
this,
called?
um,
Is it the
s-
sphenoidal segment or is it the opercular segment? What is this segment called?
sir, this is sphenoidal segment M1.
This is M1. So where does it take the first turn?
So it takes
Eh,
first turn at the genu where it becomes the M2 segment. So I should show another picture.
Yeah.
It takes. So I have different pictures in which I have tried to show M1, M2, and then M3 and 4.
So
So
so when so
can I
so my
go back?
advice, yeah, please. So my advice to you is all of you is don't
Ye-
have to use all the pictures. Just select
Yeah.
the best picture. Yeah. So
So
yes.
here I showed that this is the optic chiasm, this is the ICA, and here we have the origin of the MCA, which is which it arises lateral to the optic chiasm and medial to the sylvian fissure. And here this is the M1 segment, and here it takes the turn and which is called the genu, and it becomes the M2 segment and goes
So is
towards
the
the
so
sylvian.
is this the so is this one of the turns that was at the Lyman insulin?
Yeah. So the picture I showed Where I showed the lemon insula, that was the part where it was becoming the M2 segment because it was entering from the carotid to the sylvian cistern. Um,
So let's forget that picture for now. So
okay.
the M1 segment is from the bifurcation till from the origin till the bifurcation. Is that correct?
Yes, sir. So it divides into superior and inferior trunks.
Or the frontal and the temporal trunk, as we call it as well, no?
Yeah, yeah.
Say so that's where the M2 starts.
Okay.
I'm asking you,
Yes, yes, sir.
and it ends where circular sinus of the insula.
Circular, yeah, circular sulcus, where it becomes the opercular segments or the M3 segment,
So the M2 segment is called the sylvian segment,
insular segment,
insular segment. Yeah. So and what is the M3 segment called? The
opercular.
opercular, the
Yes.
opercular segment. Okay. Can you show the frontal and the temporal branches? We can see here. We can see here. Even in this picture, if you look at it, you can see the
These
bifurcation.
are the branches.
No, beta, where it says M2.
So
Yeah,
this is
you see.
the M2 segment. This is the
uh,
superior trunk, and this is the inferior trunk.
Maybe some. Yeah. So you can see that the superior trunk is the frontal trunk, and the inferior trunk is the temporal trunk.
Yes,
So,
sir. So
so,
also called frontal and temporal. Yeah.
what segment is this? This is the insular segment.
So M2 is the insular segment because it's lying on the insula running inside.
And can you maybe you can see the circular sinus here as well behind the M2, maybe in the insular. Can you? I think that's the circular sinus. Can you see that?
So I'm not sure here.
Okay, okay, okay. So at the circular sinus, it's at the M3 starts, right?
Yeah, M3 or the opercular part.
Opercular part. And how many turns, 180-degree turns are there in the course of MCM?
So two.
Two. So where is the next turn when M3 becomes M4?
So here we have M3, which is going towards the cortical surface and coming like going out of the sylvian fissure on the surface and goes
So
towards the cortex. So this is
what is
the
this?
turn basically.
What is this point called?
Sylvian point.
The several point. Okay. So is this the second 180-degree turn?
Yeah, this is the second one.
Okay. So obviously, the majorly in silver fissure, when we dissect a silver fissure, we have the MCA, and
Yes, sir.
we usually dissect it for the MCA aneurysm when we do instant blamas. So it's very important that you know this anatomy, and
Yes.
I would have been interested that you would have spent some more time on the Sylvian veins because they are very important too. And obviously, when you dissect the Sylvian fissure, you incorporate the vein before you incorporate the artery. And I think you did not you did not do justice to the Sylvian vein. I think I expected a little more on it, and
Okay.
maybe in the next presentation, whoever's presentation it is, maybe you could spend 5 minutes on Sylvian vein. And
Yes, sir.
right? So,
Yes, sir.
are there any questions for the residents sitting in the conference room? Is there any question?
No, sir.
I'm not asking you, Dr. Hifza, I'm asking
No,
for the
no.
other residents.
Ramin, those clear. No, let's try that.
Okay. So, whoever is presenting next week, I would like you start with the venous anatomy of the Sylvian veins and maybe three, four slides, five slides, and and do it. And because the anatomy that you just mentioned was very superficial.
Okay, sir. So I will be presenting cerebellum next week. So I'll start with the like the veins, venous anatomy, and then I'll proceed with the cerebellum.
Okay,
Then.
okay, okay. Yeah. Thank you, Dr. Hifza, for this presentation. If there's no question, then we'll join next week for the next session. Thank you, everyone, for joining.
Okay, sir. Thank you, sir. Thank you so much.